Hello, it's nice to be back. My name is Funke Squadry, aka the Skin Fairy, and I welcome you to another episode of the Ageless Woman Show. Do me a favor, pause right now, and if you haven't subscribed to our channel, please do so. Our topic today is women and pain medication. Pain medicine can actually be effective in reducing pain when used as directed. Unfortunately, these same medicines can also cause serious injury or death actually when misused or abused. They can also be addictive. Yes, plain pain medications. So it's actually better to talk to your doctor or any healthcare provider about how to safely use pain medicines instead of assuming a lot of things. It may really sound silly or a bit basic, but trust me, there is a safe and right way to take these medicines, which a lot of us do not abide by. How many of you really, when the pain is intense and unbearable, take a few more extra pills, hoping that it would ease your pain away faster and immediately? I am guilty of that in the past. You're a little bit uncomfortable and you just assume that, okay, let me take 2 more pills and it should work in conjunction with the one you took before. That is drug abuse. Ageless woman, you really need to ask your doctor about other options for to treat pain if your pain is too frequent. I, for one, I'm not too crazy about painkillers, so I opt for a massage, a steam session, or just a plain old-fashioned rest. I guess this might primarily be because of my job as a beauty therapist, but honestly, I would encourage and recommend a lot of us to do the same. Did you know that women actually experience pain differently than men? It is reported that women actually have more pain than men. Don't quote me, but I actually spoke to 3 healthcare providers when I was preparing this, and I spent a little time on Google. Some types of pain, such as chronic pain, migraines, back pain, bone pain, is very common in women for very obvious reasons. So it's safe to say that more women become dependent on prescription pain medicines than men. As the superhero women that we are, we can't afford to be ill. We can't afford to be off duty as a mom and wife. So we continue to pop these pills for any and everything that seems to want to slow us down. Women are more likely to be prescribed prescription pain medications by doctors. We're more likely to be given higher doses, and we're more likely to use them for longer periods than men. Let us talk about pain medicines. We have 2 types of pain medicines. Number 1, over-the-counter or OTC medicines. OTC pain medicines are actually very common in headache pills, colds, and menstrual cramp relief. Common types of OTC pain medicines are acetaminophen and NSAIDs. Examples of these are aspirin and low dose of ibuprofen. Sorry, I always have some difficulty in pronouncing that word. Number 2, prescription medicines. This is categorized into 2. Non-opioid medicines. These are medicines that treat pain that are a little bit more severe than normal. And ibuprofen actually falls into this. There are 2 different types of ibuprofen. One OTC and another prescription strength one. Number 2, opioids. These are medicine that can be effective for reducing moderate to severe pain. For example, after a surgery. Most of the time, by the time you come out of the anesthesia, the pain starts to come in, and it's usually very, very severe pain. So we need to be given a very high dose of pain medication. Another thing we know or we need to do is to take steps to protect ourselves and our loved ones by doing the following. Keep track of your pain. Please don't get used to pain. Don't let pain be a part of you. Take note when you feel pain. Jot it down. What does the pain feel like? What is the kind of intensity? Is it high? Is it low? What type of pain is it? Is it throbbing? Is it kneading? Where exactly does your body hurt? Is it your leg? Don't just say your leg. Is it the upper part? Is it the lower part? Is it your knee? Is it your ankle? Exactly where? So when you're talking with your doctor or your healthcare provider, you are better informed to actually let them understand what you're going through. Do not share prescription pain medications with anyone, no matter how close you are to that individual. That is a no-no. Even if it seems you're both experiencing the same kind of pain, and you say, oh, well, I got a prescription from my doctor. Do not share your prescription pain medicines. Keep these medicines locked up and away from children and other people. Do not take medicines, pain medicines, for longer than you're supposed to. Ask questions. Get facts about your medicines. Information like the dosage, how long you should take it. If you're taking other medications along with this pain medication, with this prescription medications, let your doctor know what exactly you're taking and ask if it is okay to take both these medications at the same time. Do not drink alcohol and use any pain medicine. This can actually cause fatalities. It can make you stop breathing. And of course, we don't want you dead. Discard any used prescription pain medicines that you have so it doesn't get into the wrong hands. This is very, very important. So my ageless comrade, pain in any part of a body is actually a signal that something is wrong somewhere. It could be a signal of something minor. It could be a signal for something major. But the best thing, since we really don't know what it is to always involve a doctor or your healthcare provider whenever we feel pain of any type. The supposedly insignificant fact of involving your doctor could actually save your life. Isn't it better to be safe than sorry? You tell me. I need you alive. And honestly, I don't want you to go. I don't want you to die until you're at least 85 years. So please, take caution with pain and any other medications around you. Let us save lives as best as we can. Watching this video can actually save a life. So do me a favor, share this video once you're done. All right? See you next Wednesday, same time, for another exciting episode of the Ageless Woman Show. Thank you.